Thank you. So cancer prevention is a fairly new program within health promotion. It's only about two and a half years old. And we're trying to embed some of the cancer prevention, early diagnosis and skin cancer within already health promotion initiatives. So myself and 5 colleagues across the country are looking at SunSmart in some of the third level institutions. So why are we looking at skin cancer in particular? Well, it's the most common diagnosed cancer in Ireland. There's about 11,000 cases every year. And that's divided into non-melanoma skin cancers, which are by far the most common, which are not as serious as the melanoma skin cancers, but the treatment is still quite invasive. So most skin cancers are largely preventable. It's due to a cumulative UV exposure. So we want to look at what are the sort of modifiable risk factors in terms of skin cancer prevention. So our exposure to UV radiation in terms of our exposure every day, our intermittent exposure outdoors, also in terms of sunbed use, so that increases our risk by about 75% of developing a melanoma, and there is a piece of work ongoing about sunbed use in Ireland with the Department of Health, with a recommendation from a working group around a ban on sunbeds. Sunburn as a child is also a key risk factor, so about 80% of primary school children remember having a sunburn, so that also increases our risk. We're also doing some work in primary and secondary schools as well as third level. And we know that a lot of young people have sort of low engagement measures when it comes to skin protection and SunSmart behaviours. The most recent SunSmart campaign that was just launched there at the beginning of April talks about the increase in sort of experiencing sunburn. So we can see from the statistics that it's showing an increase in those kind of low engagement sun protection measures that are increasing year on year. So these findings sort of reinforce that need for really engaging younger audiences in this kind of work. So who else are most at risk? So we've heard today about this settings approach and what we can do to embed some of what's already happening on campus. Those who work outdoors have a higher risk than those who are working indoors in mainly sedentary sort of office type work. Those who spend long periods of time outside in sort of leisure time activities that are outdoors a lot. We also mentioned children, as we said, that increases the risk of developing a skin cancer, and then people who use sunbeds as well. So these are the sort of high-risk groups, and the Skin Cancer Implementation Plan has actions that directly impact on those high-risk groups. So what's the SunSmart initiative? Well, we've heard about the UL framework today, and they led the way last year by launching the SunSmart initiative on campus in University of Limerick with my colleague Bernadette Mullins. So this aligns with the Healthy UL framework, and also it aims to promote sun safety practices and behaviours, increasing education, looking at the environment, but also looking at sort of a whole campus approach as well that kind of will look at what can be done over the next 3 years. So it's a fairly new initiative, and then we're looking at how we can work with other third level institutions as well. So one of the most simplest things we've started with is the installation of sunscreen dispensers. So this provides a factor 30 litre of sun cream that's available to anyone on campus. I'm actually glad it's sun is shining today, because every time I talk about SunSmart and skin cancer, there's a storm warning or a weather warning. So I'm actually glad the sun is out today. So that's one simple thing we can do to just raise awareness and actually really just have a practical application of something which changes the environment. So there's one here indoors and one outdoors here in MTU. Also just giving further information around the UV index. So, you know, they say to put some protection measures in place when it's 3 or above. It's about 5 today, even though it's not very hot. So that just gives you an idea that, you know, our UV exposure is about, you know, it gets through cloud and glass. It's not just on a hot, sunny day. There's other things we need to look at too, things like shade, for instance. that's going to be a little bit more difficult as we look at sort of our environments, if you like. Other kinds of pieces of work we've been doing, webinars for staff and students, sharing information, resources, collaborating with our student health services, with the Irish Cancer Society, to just sort of raise awareness about skin cancer and sun protection measures. So it's really a start in just getting this topic sort of on the radar for staff and students on campus. This is a truck driver in the US who drove for 28 years, and as you can see, that's an example of how UVA rays to do with aging rather than UVB to do with burning gets through. And so maybe one of the things we can do is look at, this kind of interest in skincare and anti-aging as maybe a way to kind of get some of these messages across about wearing SPF daily. And then also, it's not just all about sun cream, there are other sun smart behaviours as well in terms of shade, clothing, hats, sunscreen, so there are other areas we need to work on too. Thank you very much.